FDA-approved swallowable intragastric balloon, which can be swallowed without any sedation or without the need for any surgery. It's a non-surgical weight loss program, or without the need for even endoscopy. The patient swallows, as you'll see in a few minutes.
So this is the first time that you can actually swallow a balloon, no surgery. So how safe is the procedure?
It's an extremely safe procedure. As you know, FDA has gone through very stringent and very strict trials to approve this procedure, and this was just approved last year, sometime in November.
That's incredible.
Very safe procedure.
Doctor, talk about the procedure. How does it work?
Well, the procedure requires there has to be some patients have to meet a criteria. We want to make sure not all patients are candidates for this procedure.
Okay.
So they have to have a consultation with a physician, just like myself, or my dietitian, and see if they're candidates for the surgery, first and foremost. And if they meet that criteria, as stated earlier, the BMI between 30 and 40, and if they're good candidates, then of course they will be scheduled for this procedure. The way the procedure is done, they are scheduled. They just have to fast for a few hours prior to the procedure, and they come fasting and swallow this balloon, and simple as that.
And so how long does that procedure actually take?
The procedure, we do this procedure in 3 different stages, the 3 balloons.
Okay.
So the first balloon on an initial visit is, we can place this within approximately 10 minutes.
Okay.
Not more than that. Then they come back 2 weeks later for another balloon, and approximately 2 to 4 weeks later after the second one for a third balloon.
And no downtime?
No downtime.
Wow, that's amazing. So we're watching you with a patient today, and you're swallowing some balloons. Tell me about what we're seeing here. How many balloons is this patient swallowing?
So right now, this particular patient, this is a third balloon that she has already swallowed 2 balloons, and she had remarkable results as a result of this balloon. Very little discomfort.
How much weight can you expect to lose, and how long do you keep the balloons in?
A typical patient can lose between 15% to 30% of their body mass index, or in other words, they can lose from 30 pounds up to 100 pounds of their body weight.
My goodness. And how long do you keep the balloons in?
It's about approximately for 6 months. That's the FDA is allowed. After 6 months, they have to be removed.
Okay. And then after they're removed, do you still continue with them? Tell me a little bit about what happens after.
It's a comprehensive program. Just remember, balloons are not a magical cure for weight gain,
right,
and they are just merely a tool. It's just a jump start for a complete, comprehensive lifestyle modification, dietary modification.
You're really helping them change their whole life.
Exactly.
Very good.
So we have a comprehensive team with behavioral therapists, dietitian, physicians who will help this patient through this journey. So it's a journey, and unfortunately, obesity is a disease, and we have to treat that as such. And then these balloons and these new intragastric exciting devices have just been a vacuum that we were missing.
Wow.
Between the diet and exercise and pills and the gastric bypass surgery.
Yes.
In the last 2 years, FDA has approved a number of those.
Fascinating. Dr. Kazi, thank you so much. We are talking about the Obalon balloon system procedure. For more information, call the number on your screen, or you can go online to shapeologyaz.com. And if you'd like to try Shapeology, there's a special for Arizona Midday viewers. You can get a free consultation and $500 off a procedure. Again, you can visit shapeologyaz.com for more information, or call the number right there on your screen. And still to come on Arizona Midday.